Knock, knock.
Hello.
Hello, how are you this
I'm
morning?
doing fine.
Oh, my name is Agnes. I'll be your nurse today. I'm gonna do assessment for the baby. So, how did you sleep last night?
Well, the baby kept me awake.
Oh, that's why she's sleeping now.
I know.
What did you name your baby?
Annie?
Oh, that's nice. What a joy.
Yes.
Uh,
Worth it.
I know it is. So I'll compare the bracelet for the baby. His baby Amy is born today, which is good. I will compare the bracelet too. Yes, you're the mom.
Yep.
So that is good. I have the right baby. So when we are going to do the head to toe assessment for the baby, you are free to stop me, whatever. If you have any question, I'll be doing some teaching. I'll have to tell you the abnormal and the normal. So as we are assessing baby Amy, okay? So I've washed my hands, everything. I'm ready to go. So what I'll do, I'll start from the least invasive, so that the baby can give us easy time to do the assessment. So first of all, I'll check on the respiratory. As I can see, I'm looking at the abdomen. The color is good. The skin looks okay. So I have to count the respiration. Normally the newborns, they breathe with the belly. They are good nose breathers. If there is anything abnormal, the baby will be, it'll be grunting, it'll be nose flaring. That will mean he has respiratory distress. But for Jaime, she looks very comfortable. So I will count her respiration, the rhythm up and down of the abdomen. So I will count for 1 full minute. The respiration. According to Canvas, the respiration is around 35, which is okay. The range is normally 30 to 60, so MA is good. So the next thing I'll do, I'll listen to the lung sounds. Since I have a regular stethoscope, I listen from the bell and comparing both sides, listening if there is any adventitious sounds, if there is any crackles. It sounds clear in all fields, so baby Amy is doing good. I want to listen also to the heart, pulmonic, aortic, valve, mitral valve. S1, S2 is audible and the rhythm is regular. So I will also listen to the apical pulse, which is found in the between 4th and 5th intercostal muscle space. So I will listen for 1 full minute. According to the Canvas, the heart rate is 135 beats per minute, which is okay. The regular one is the regular usually is 110, between 110 to 160. So for her, it sounds right. So she's doing well. So she's doing okay. What I'll do, I will also look at the front. Since I'm here on the belly, I will listen to the bowels. which is 4 quadrants. I'll start from clockwise going. The bowel sounds are all present in all 4 quadrants. Usually the baby within 2 hours, the bowels are, they're already present and they're active, which is the same thing right now. So from here, I will look at the reflexes, the moral, the rounding, all the reflexes the baby has at this age. So with her arms, I'll check out the moral. When I put her down like this, she'll form like a C shape, which is good. That is reflex. If they're flaccid and they're just the tone is not strong, that means it's not. That should be reported if that happens. But for baby Amy, she's fine. Here too, when I'm holding her hand, the fingers will curl against my finger, both hands. The feet too, when I put my finger here, they'll curl, which is normal. They'll curl towards, which is normal. If you do this, the Babinski reflex, the toe, the big toe will dorsiflex, and the other fingers will come in, which is normal for a baby. That goes away later. So from here, I'll also remember to count the fingers, because usually others have more than 5 fingers in one hand, so it's good to know that the baby has all 10 fingers and all 10 toes. So this is 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's wonderful. Here too, they're 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That is good. So she has 10 fingers, she has everything okay. So I'm going to check on the sucking reflex. So as I'm checking on the sucking reflex, I'll put my gloved finger in, check on the tongue. While I'm in here, I'm checking on the soft palate, the hard palate, the cleft. This is how you know. And the baby seems to have a very good sucking reflex, which is good. So, and also when I touch on the side of the cheek, the baby will turn to the side and try to follow where the cheek is touching. That means she has a good rotting reflex, which is wonderful. So when we look at the head, just checking on the head, you assess having any where there's no hair, checking for any bruises. The head looks fine. The sutures, the sagittal suture and the coronary suture, which is not fused yet, the frontal, anterior and posterior, they are all present. The fontanelle, at times, it's a diamond shape. At times it takes like it takes a little while to resolve. It takes almost 18 months. So at this age, just say it's not it's not fused yet. You can say it. And at times there are children who have the caput sarcoedema, which is underneath the skin. That is very normal if it's a bulging, and it will resolve. But if the fontanelle is sunken, that means the baby is having either dehydrated. That's how you know whether the baby is dehydrated. And also you have hematoma, acrohematoma, which is the blood underneath the skin, the scalp. That also resolves with time. So for baby Amy, she looks all fine. Everything is normal for her. So when you're looking at the ears, both of them, they're all formed. At times you might find other children who have like a malformed ear, one ear, but for baby Amy, he has 2 ears. And when you align them, you do an imaginary line from the eyes to the ears. They should be like 90 degrees. They should align. If you see one ear is below, you know, the eyes on the other side too, that means the baby has, you know, has some, that's something that should be reported and documented right away. So when we look at the nose, as I said, the children are noso breathers. You occlude one nose to breathe with the other, occlude the other nose, then you'll find the patency is good. So with the eyes, normally they close their eyes. I need to dim the light so that I can you know, they don't open the eyes easily. So you dim the eyes to see the accommodation of the eyes. If they react to the light, everything. So at times the baby eyes will be moving so quick. That is very normal for a, you know, for a 24 for a newborn. So the baby is good. When we come down here to the shoulders, at times you find that you know, the one shoulder is they're not aligned. So we check the symmetry. They have to be symmetrical, so that, you know, at times there are children who are born with shoulder, they come through the shoulder, so it's called shoulder dystocia. So one of the shoulder is dislocated, so we have to check. But for her, both of the shoulders are aligned. So when we check also, back to the belly, the abdomen is round and soft, the bowels were clear. So about the cord has two arteries, one vein, which is good for a baby. If you find one is below, the other one is on top, that is something that needs to be recorded. So, and taking care of the stump, taking care of this cord, you need to, you know, just clean the baby. Don't sponge, dry, no moisturizing, and it will fall off between 8 to 10 days, which is good. So how many hours do you feed? How many hours? How is the feeding pattern for the baby?
I usually feed my baby about every 2 to 3 hours.
Oh, that's good. That's quite normal. That's, you know, babies feed. Those who are very active, those who have good appetite, they eat well. So that is good. That is expected. So checking on the genitals. So how many times do you change, you know, how many times did you change the diaper? Did she have anything, you know, like bowel movement?
Let's see. Well, she had one bowel movement. It was really sticky. Something I've never seen before.
Oh, yeah.
Very dark.
Sure, that's very normal. We have something we call meconium. That is a stool passed between the 24 to 48 hours. It is sticky and it's very normal. That's what we expect from a newborn baby. So with the girl, if it's a baby female, we have to check on labia minora, labia majora. They are all formed. They cover in the clitoris. And if it's a boy, that is very normal for a mature baby. If it's a baby who is preterm, at times it's not all covered. But for her, it looks good. Everything is good. So if it's a baby boy, if it's a baby boy, you need to check at the penis, check at the tip of the penis, the meatus, if it's open. Check if the testes are descended with a mature baby, the testes are descended already. If it's premature, you might find they're not, they're not descended. The balls, you'll feel them, they're like marbles, 2 marbles. So that's what it's like. So if it's a baby boy with circumcision, some parents, circumcise, choose to circumcise them if they are boys. So the way we take care of them is to, you have to report if the baby is overbleeding, or you should not remove the exudate, the yellow exudate, you leave it there. That's how it heals slowly. You don't put any, you don't use wipes, you just use water. So, and it doesn't take long to heal since it's a small baby. Okay, so moving on, we look. Now I want to turn my baby, look at the back, looking at the curvature, the spinal curvature. The spinal looks good, and you might see you might see, we check for the sacral dimple. If there's a dimple, that's an abnormality. Normally spinal bifida, which is a tibial, defect. And if there's some coloring like blue, purplish, that is a Mongolian spot. Mongolian spot is okay, especially for colored babies, and it resolves, it goes away after a few weeks, which is good. As I'm back here, I'm looking at the gluteal folds. The gluteal folds are symmetrical. You might find other babies have asymmetrical gluteal fold. One is low, the other one is high. That will indicate hip dysplasia or hip dislocation. Or at times one foot is shorter, the other one is longer. So for baby Amy, she's all good. So from there, I need to, weigh my baby, make sure she has a clean diaper on, so that you can get the accurate measurement. So I'll zero the machine. So my baby weighs around 5.5 lb. That is, so she's good, which is normal. The normal is 5.5 to 8.8 lb pounds. So with the height, I have to bring the thing all the way, straighten the feet. Is around 24 inches. That's it. The height is usually 12 to 45 to 55 centimeters. Then I will check the circumference of the head. I have to put it above the eyebrows. That is around 36. So yeah, that's the normal. The normal is around 32 to 36. I'll also get the chest circumference. Which is usually, for her, which is usually 30 to 33 according to the ATI. That is 12 to 13 inches. For baby Amy is 30. So that is wonderful. Before I forget, I needed to do the temperature. The temperature. So we normally get the temperature for a baby on the auxiliary. The temperature is usually 36.5 to 37.5 or 97, that is 97.7 to 100.5, which is good. So she's good to go. So thank you very much. She's been so quiet for me to finish all the assessment. I'm glad she didn't wake up. Do you want me to get the baby for you, or will
Oh,
you-
I think she's fine.
She's fine, she'll sleep. All right. So I perform hydration. So okay, see you next time. You have the call light, and you can press your call light for.
Thank you.